Hello everyone. This is the summary title of my research topic. My name is Endre-Botond Gagyi. I'm from Transylvania. I graduated last year from the Medical University of Marosvásárhely as a medical student. I came here on an Erasmus scholarship and started a one-year program at the Translational Medicine Center. My vision regarding to this topic is that we can reach a state where we can prevent most of the patients from the recurrence and the progression of acute pancreatitis. And my mission is to make better recommendations to patients by understanding the progression of acute pancreatitis into recurrent acute pancreatitis and chronic pancreatitis. Because I'm here on a 12-month fellowship program, currently I'm working on one project. This project will be a systematic review and meta-analysis, and it is called One Episode of Acute Pancreatitis is Just the Beginning, the Incidence Rate of Recurrent Acute and Chronic Pancreatitis. This is the current status of my manuscript. We would like to submit it at the American Journal of Gastroenterology. Let me briefly introduce the background of my study. The incidence of acute pancreatitis varies globally, affecting from 5 to 80 people per 100,000 and appears to be increasing around the world. Besides that, it may lead to a prolonged hospital stay and also associated with significant morbidity and mortality. And unfortunately, it can lead to recurrent acute pancreatitis and chronic pancreatitis as well. Data on the risk of developing REP and CP and factors affecting disease progression have been heterogeneous. Previous studies have shown that its progression to CP and REP has been reported to occur approximately from 4 to 24%, respectively from 17 to 35% of patients following the first attack of acute pancreatitis. This heterogeneity may be due to the fact that different studies have different follow-up times. Therefore, our aim is to produce a statistically most accurate estimate, taking into account the time factor to assess the incidence rate of recurrent acute pancreatitis and the chronic pancreatitis in patients after different number of episodes of acute pancreatitis. As this is a study examining the incidence, the COCO-POP framework is applicable for posing the question. This study does examine the condition of recurrent acute pancreatitis and chronic pancreatitis in a context of after the first episode of acute pancreatitis, in the second case after different number of episodes of acute pancreatitis in a population of a general patients population. To achieve our goal, we have done a systematic search in 3 big databases using this search key. On the left side, you can see the Prisma flowchart of our selection. Out of 9,400 articles, finally, we included in the 20 articles in the quantitative synthesis. These are our first results. On this figure, you can see 2 forest plots. These are not subgroups. There are 2 forest plots showing the incidence rate, or the overall incidence rate of recurrent acute pancreatitis after acute pancreatitis in adult and pediatric patients. So the incidence rate in adults is approximately 6 cases per 100 person years, while in children is approximately 4 cases per 100 person years. On this figure, you can see 2 first plots showing the overall incidence rate of chronic pancreatitis after acute pancreatitis and after recurrent acute pancreatitis in adults. So the incidence rate after acute pancreatitis is approximately 1 case per 100 person years, while after recurrent acute pancreatitis is approximately 4 cases per 100 person years. On this figure, you can see the recurrence rate in adults based on etiology. The highest recurrence rate was observed for hypertriglyceridemia-induced and alcohol-induced acute pancreatitis, which are 8 and 7 cases per 100 person years. On this figure, you can see the recurrence rate in adults based on severity. The highest recurrence rate was observed for moderate acute pancreatitis, which is 8 cases per 100 person years. On this figure, you can see the incidence rate, the progression rate into chronic pancreatitis in adults based on etiology. The highest progression rate was observed for alcohol-induced acute pancreatitis, which is approximately 3 cases per 100 person years. The strength of our study is that this will be the first meta-analysis to investigate the progression of acute pancreatitis, taking into account the time factor, the follow-up time, assessing even the pediatric population. The strict inclusion criteria, we included only articles where the diagnosis of acute pancreatitis was made according to the revised Atlanta classification, and the detailed analysis based on the severity and etiology of acute pancreatitis. Of course, our study have several limitations. The majority of the included studies were retrospective follow-up studies and missing individual follow-up data. So we had to use the mean follow-up data to calculate the incidence rate. We found that the highest the recurrence rate was the highest in adults, hypertriglyceridemia-induced and moderate acute pancreatitis, while the progression rate into chronic pancreatitis was the highest in alcohol-induced acute pancreatitis and recurrent acute pancreatitis. Implication for practice is that we hope this will provide strong evidence to both patients and physicians that these patients are at risk for progression of acute pancreatitis, and this will draw attention to patient awareness and highlights the importance of prevention by any intervention. Implication for research is that this draws attention for the need for prospective multi-center studies assessing acute pancreatitis progression with the same follow-up time for all the included patients. So my plan is to finish this by the end of June, and thank you for your attention. And,
what was the highest number of articles regarding etiology? Was it, I guess, alcoholic, or did you have a high number with hyperlipidemic, hypertriglyceridemic pancreatitis also?
For biliary were the highest number.
Biliary was the highest. And what was the number regarding hypertriglyceridemia?
Only 4. And,
but patient or episode numbers?